Alright, we're on. Alright, Emma, welcome to our gym. What we're going to do now is I'm going to take you through a pre-screening tool which will, where I'll be asking you questions about your health and fitness and also your medical history, so we can determine if there's any risk factors for you undertaking exercise.
Sure.
So can I just start with your full name, please?
Okay, Emma Louise Quirk.
Thank you. And what is your date of birth?
25th of June 1969.
And today's date is the 22nd of the 10th. Beautiful. Alright, so there's 7 questions in this,
Sure.
which are essentially about the medical side of your health. So, has your doctor ever told you that you have a heart condition or have you ever suffered a stroke?
No, nothing at all like that.
Good. Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
I have done in the past, not for a long time, and I did get it checked out. I actually had a full cardiac stress test done. It was fine.
Okay, so as far as your doctor is
Cleared,
concerned, you're cleared for...
exercise, don't worry,
Okay.
it's all good. Probably a panic attack.
Alright, fantastic. Do you ever feel faint or have spells of dizziness during physical activity or exercise that cause you to lose balance?
No, not really, no.
Have you ever had an asthma attack requiring immediate medical attention at any time in the last 12 months?
Thankfully, no asthma.
Good. Do you have diabetes type 1 or 2? Have you had trouble controlling your blood glucose in the last 3 months?
No.
Cool. Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity?
No.
Okay.
I do
fantastic.
have various problems, but they should be made better by exercise, not worse.
Okay, fantastic. Sorry, my video made a noise. I'm just going to make sure this is still recording. Yep, it looks like we're still going. And the last question, do you have any other medical conditions that may make it dangerous if you participate in exercise?
No, nothing I'm aware of.
Okay, fantastic. So given that you've answered no to those 7 questions, you are clear to undertake light to moderate intensity of physical activity. Could you please just sign down the bottom and
Sure.
date it there, 22nd of October. Brilliant, thank you. So I might just quickly talk you through what moderate, vigorous and high intensity means. So if we start with sedentary level of activity, that are activities that involve sitting or lying and have very little movement associated with them, which would also be considered less than 40% of your maximum possible heart rate that your heart could safely. So maximum heart rate would be at your most vigorous exercise, what would be the heart rate, so 40% of that would be sedentary. Light to moderate is somewhere in the 40 to 70% range of that heart rate, and that's sort of considered, those exercises would be, a light would be aerobic activity where it doesn't make a noticeable change in your breathing, and you could sustain that for about 60 minutes or so. A moderate rate of exercise would be aerobic activity that's able to be conducted while you're maintaining a conversation uninterrupted, and you'd be able to sustain that between 30 and 60 minutes. Vigorous and high, of course, is between 70 and 100, greater than 90% of your maximum heart rate, and in those situations you wouldn't be able to carry on a conversation while you're working at that intensity, and also the duration would be less than you could sustain that for. Alright, we're going to do stage 2 of this pre-screening tool, so I'm just going to write your name down there again. So if I could write down your age, that would be 45. Your gender would be female. So this just asks a few questions about your levels of activity and your sort of family history of health to determine if there's any indications of risk there. Okay. So within your family history, is there a family history of heart disease, for example, stroke and heart attack from father, mother, brother, sister, son, daughter?
Okay, well, not father or mother at this point. I've had a grandparent, a couple of people on my father's side have had sort of fairly early heart attack deaths, I guess, but...
Alright, no, that's good. Do you smoke cigarettes on a daily or weekly basis, or have you quit smoking within the last 6 months?
No, I quit smoking many years ago.
Okay, fantastic. So could you describe your current physical activity or exercise levels to me? As I've described to you in sedentary, light, moderate and vigorous, could you tell me when you undertake exercise, which of those levels would you most commonly
I'm probably somewhere in light to moderate. I like walking, so I do try and get some nice long walks done each, couple a week. And I have had a foot injury recently, so that's really held me back a little bit. I've had a plantar fasciitis, which has fixed itself up now with a bit of rest and time. So, I'm here hoping I can increase my levels of fitness again and lose a little bit of weight.
Good. And could you tell me how many sessions of exercise you might take per week?
Well, I usually do about 2 big walks a week, and I think I can probably work out my life so that I could get into the gym on maybe 3 occasions a week.
So would that mean you're doing about 5 a week?
That's what I'm hoping to do.
Is that what you do currently, or you're
I'm not doing that currently, but I'm wanting to come, back into it now. So. All
right. So if we said you're doing, say, 2 regular sessions a week of moderate intensity activity, does it sound about right?
Yeah.
Okay, fantastic. And what would be the duration of each of those sessions? So how long would you go for that walk for?
About an hour usually.
Okay, 60 minutes. Nice. Good. Okay, so that's 120 minutes of moderate activity per week. Okay, good. So that is great. Do you know your height, or could we take a measurement of your
You can certainly measure me. I think I'm 164, but we can have a look.
Alright, fantastic. Let's check that out. Could you take your shoes off, please? Okay. Thank you. Just watch your step with the smells there.
Thank you.
So if you stand with your heels right against the skirting board there, just a nice erect posture. What did you say?
I thought 164.
Okay, I think we're going to go with 163 according to this one.
Okay.
All right. Fantastic. All right, come and have a seat. Okay, and having just offered you a seat, if you wouldn't mind jumping on the scales, we'll take a weight measurement as well. And if you maybe take your jacket off if you want. Jackets can often be at a few hundred grams there.
5 kilogram jacket.
Okay, 73.0, cheers. Alright, now would be a good time to sit down.
Okay, sure.
Okay, what I'm going to do is just do a quick calculation of your BMI. Here with my little calculator.
Can I put my shoes on again now? Do you need shoes on?
Yes, you may put your shoes on. Absolutely. So we do 1.63 Okay. So you have a BMI of 27. Which, according to this, is relatively fine. A few more questions. Have you been told that you have high blood pressure?
No, I have low blood pressure.
Okay. Have you been told that you have high cholesterol?
No.
Okay. Have you been told that you have high blood sugar?
No.
Okay, so you have a risk factor here of 1, which is a good result. Three more questions here. Have you spent time in a hospital, including day admission, for any medical condition or illness or injury during the last 12 months?
No.
Cool. Are you currently taking prescribed medication for any medical conditions?
I am. I take thyroxine. I was diagnosed with an underactive thyroid a few months ago.
Okay, thank you. Are you pregnant or have you given birth within the last 12 months?
No.
Okay. Do you have any muscle, bone or joint pain or soreness that is made worse by particular types of physical activity?
So in my recent exercising history, I've had the plantar fasciitis that I mentioned to you. That seems to have really cleared up at the moment. My foot's coping really well with the long walks I've been doing. I've got myself some good shoes, and so I think it's hopefully going to stay fixed.
Okay, fantastic. And so you're operating on also doctor's instructions with that in regards to your exercise and physiotherapist things,
Yeah.
Okay, fantastic. Good. Well, let me just check, but I think that wraps that up. Almost, yeah. So as I discussed, the intensity level that would be best for you would be in that moderate range. So that's 55 to 70% of your maximum heart rate, which I can tell you what that should be in a moment, I think. So that's kind of an aerobic activity that can be conducted while maintaining a conversation where you could last between 30 and 60 minutes. The other way to determine that is called perceived exertion, so how you would rate how much exertion you're sort of doing at that moment, where 1 would be very, very light, sitting like this would be 1 now, and 10 would be very, very, very hard, where so much exertion that you might even be close to fainting or throwing up or something. So for moderate to somewhat hard, it would be around 3 to 4. So if you can rate yourself 3 to 4 out of 10 in terms of your physical exertion, that's about that moderate category.
Right.
But as you do more exercise and become getting here more regularly, you'll find that you'll be able to gradually sort of step that up. And if we check in again, about 6 weeks' time and see how your fitness is improving, then you'll find you'll be able to do more exercise in a more intense category.
Okay, sure.
Good. All right. Well, I think we'll leave it there.
Thank you.